Okay, I'm gonna be re-recording because my first video was really long. So I made sure I got so this is a 76-year-old male. He has a dog bite. He does have hypertension, and he uses lisinopril. Suturing is indicated since it is a nail bite. I mean, since it's a dog bite, and he needs it, right? So I went ahead, performed hand hygiene. I put my PPE on. I got informed consent. I did do his lidocaine for local anesthesia. I irrigated thoroughly already. I debrided the wound because it is on his finger, so I made sure there was any macerated edges, so I made sure I cleaned it off. My concern will be for dehiscence. So I want to make sure it doesn't dehisce. So I'm going to go ahead and use a nylon monofilament 4.0 non-absorbable. Since it's going to be on the outside, it can't be absorbable. I did do another video, but it was really long. So now I'm going to be doing another one, just making it shorter to see hopefully it'll be shorter. I'm going to be using, since I am a novice, and I mean, he knows that. So indications for suturing is because it is an open wound. Okay, so I'm gonna clean my area. Since it is an open wound, the sutures are indicated. Oh my gosh, now I'm so nervous because I just took a So it's a deep tissue involving the subcutaneous tissue. It's commandingly important. It was actively open. It's a dog bite, so it's dirty. So I'm gonna be checking him for tetanus, and he's gonna need antibiotics. Since it is it's a finger, so it's more movable. So I am gonna be asking. So I'm gonna be using the nylon monofilament 4.0 that I already have open here, and I'm gonna go ahead and start suturing. I do have the appropriate PPE on. Okay, I have gown, gloves, sterile gloves. I have a face mask just in case anything comes up. Like I said, I already irrigated the wound. I already cleansed the wound. I made sure that if there was any macerated edges, I cleaned it with my scalpel. And I went in ahead and irrigated it. Okay, so I'm gonna go ahead and start my procedure. I'm gonna use a smaller edge, just a smaller one now, because I want to make sure that I be able to finish in time for the 10-minute video. If it takes me a little longer the first time, it's okay, because I am a novice. I am gonna go at 90 degrees, grab the tissue. The dog, I'm gonna get bites. I said dog bite, but I mean it was his subcutaneous area. I'm gonna do simple interrupted. I didn't say that. Simple interrupted because it is a high tensible area to joint. It's a finger. It's very movable, so I need to use a strong material. I'm gonna go ahead and do two. The first one was a 2 loop. Now it's gonna be 1 loop, and I am gonna do I'm gonna do about 5 knots, and then I'm gonna make sure my sutures are all on one side. So I'm gonna be doing it to the right side. Okay, and like I said, I'm gonna be doing simple interrupted. I'm using nylon filament, nylon monofilament 4.0 since it's a finger. Okay, grab my needle at a 90-degree angle. I'm going in 90 degrees to the skin. I'm grabbing the skin. Since it is nylon and it's a little longer, it's a little harder to use, but we're gonna get there. Okay, so I'm doing 2 loops. I'm pulling out one edge. Me doing 3 knots. Okay, it's okay. I'm just gonna take my time. I don't really have a lot of time though. That's my problem. Okay, so that's 2 knots. I'm gonna do 1 more knot. Okay, and I'm gonna put the knots to one side, so I'm gonna try to put it on the right side. Okay, I'm gonna do it's a little loose, so I'm just gonna make sure grab another one and then just tie it to make it tight. Since I am using nylon, it is a little bit more slippery. Okay, so I went ahead and got my I'm sorry, I don't know if you can see, but my area is a little my string's a little long, my sutures, so I'm just cutting them. Okay, so now I'm gonna go ahead and just use 1 more stitch. Okay, I'm gonna go to 90 degrees. I'm grabbing the dermis. Okay, and I'm gonna be pulling out. Okay, my first knot is 2 loops. Okay, so that's 3 knots. We're doing 5 knots just to make sure it stays, because the risk is making sure that there's no dehiscence. So that's what I'm concerned about. So now, since I'm almost done it, I'm gonna ask him about 1 more. Grabbing the tip, pulling out. Okay, perfect. Okay, cutting it. Okay, so now I cut the stitches. Okay, so like I said, this is a 76-year-old male. Before we started the procedure, I did get informed consent. I did put on my PPE. It is a dog bite, so it is a very dirty wound. So I irrigated the wound. It was a little macerated, so I used my scalpel and I cleaned off the edges. The risk is for dehiscence, so I want to make sure there's no dehiscence. I asked for his immunization status, making sure he has a tetanus shot. He told me it was about 10 years ago, so he's due for it. I'm gonna ask him. I checked for any like tendon damage, any neurovascular, any foreign body material. There was nothing there when I irrigated it. Like I said, I performed irrigation. I used nylon monofilament non-absorbable suture 4.0. My technique was simple interrupted, as you can see right there. I was test this. I'm gonna give him he's gonna be due for an antibiotic. Also, since it was a dog bite, I want to make sure that he does have his rabies shot. I performed the wound care instructions, so making sure that you come back if you see any redness, any swelling, any discharge, any pus, anything coming out, for just making sure if there's no risk for infections. I would arrange for him to follow up within 24 to 48 hours just to make sure everything looks good. And then if the sutures will need to come out, so I'll arrange follow when he comes back and make sure everything else. All right, so it was a 76-year-old male, dog bite. I irrigated, I cleaned it. It was indicated because it was a wound. It's an open wound. There's risk for infection. We don't want that. Like I said, I assessed for everything. All right. Thank you so much. Okay. Oh, it's 9 minutes. So I want to make sure. I don't know if I said appropriate PPE. I cleansed the wounds. You can see my sutures are all simple interrupted. The sutures are to the right side. And I used the nylon monofilament non-absorbable sutures. And then I gave him his wound care instructions for his follow-up. I assessed tetanus. I gave him his antibiotics. Make sure making sure that there's no wound infection if he comes back. I removed any foreign body material. It debrided any non-viable tissues, and I did my sutures. Thank you.